Hello and welcome back to DentoTatva short lecture series. In today's short lecture series session, I have picked up an interesting topic, that is vertical root fracture. There are main two parts, that is the coronal or the crown portion, or radicular or the root portion. So when we talk about injury in general, it could either be related to the coronal or the crown portion, the portion that is visible in the oral cavity, and the radicular or the root portion that is inside the alveolar socket. So it could either be a fracture related to the root, a category known as a vertical root fracture, which is actually a longitudinal fracture involving the cementum, dentine and the root canal system of a root. So a fracture that is extending longitudinally or axially involving the tissues related to the root, that is cementum and dentine, and even the root canal system of the root is involved, that is known as VRF or vertical root fracture. Mostly seen in cases wherein the tooth has recently or maybe in the past have received root canal treatment. It is endodontically treated tooth, and maybe the patient failed to get a crown or a cap over it. There was already presence of micro cracks or micro fractures in the dentine, which when the tooth was subjected to heavy forces after getting endo treatment, maybe during endo treatment, it resulted in a fracture which initiated from the inner root canal wall and it extended towards the periphery or the outside wall. If the previous clinician, while attempting endo treatment, he removed excess amount of sound dentine. Now dentine is the strength part of the tooth, and removing excess amount of the radicular dentine will at some point result in fracture of the root, exposing the intracanal wall to disinfectants and various medicaments that are used during endodontic treatment. So EDTA, for example, post endodontic restoration, and if it has been inappropriately done by the dentist, so this is going to subject the tooth to unbalanced stress distribution, resulting in VRF. The next is pathogenesis of VRF. So VRF, how it initiates? First is crack. Cracks are micro cracks or tiny defects in the dentine from where VRF actually initiates. In advanced cases of VRF, there is complete fracture, which is also known as a split tooth. In early stages of VRF, the patient will have minimal signs and symptoms because there is not much of bacterial buildup for now. There is going to be complete absence of any kind of periapical pathology in early stages. So in clinical features, if we have to talk about, there could be presence or absence of apical periodontitis. So tenderness could either be present, could be a direct visualization of a fracture. When you inspect the tooth with the help of an explorer or a probe, you'll see that there is a fragment which is attached with the help of gingiva for now, and there is mobility of that particular fragment. Now in certain cases, a deep periodontal pocket, localized pocket, could also be found in cases where there is VRF, and there could be a presence of sinus because in later advanced stages there is pathology, there is widening of the PDL, there is J-shaped radiolucency, there is ingress of bacteria, bacterial biofilm is there, could be sinus. Sinus means there is pus, and if there is pus, the tooth is going to be mobile. In most of the cases, VRF is hard to treat and the prognosis of such cases is rather poor. So in most majority of the cases, the tooth actually goes for extraction. Now if in case it is a multi-rooted tooth and you see the other half of the tooth, supposedly it is 3-6, and you see the distal root, there is fracture, but the mesial roots are hale and hearty, and the root canal that was previously done looks okay to you. Or maybe if you want to do a retreatment also, what you can do is you can do a root amputation or a root resection, wherein you will remove the infected or the the root portion that is in question, and you can see if the tooth becomes healthy. The rest of the remaining tooth you can keep it on follow up.